A staph infection is caused by the bacterium Staphylococcus aureus, a type of bacteria commonly found on the skin or in the nose of healthy individuals. In most cases, Staphylococcus bacteria do not cause harm, but if they enter the body through a cut, wound, or other openings, they can lead to infection. Staph infections can range from mild skin conditions to severe, life-threatening infections. The symptoms of a staph infection can vary widely, depending on the area of the body that is affected. Common symptoms include skin infections like boils, which are painful, pus-filled bumps that develop under the skin, cellulitis, which is red, swollen, and painful skin that may feel warm to the touch, impetigo, a contagious skin infection causing blisters or crusted sores, and abscesses, which are collections of pus in the skin or soft tissues. Severe infections may involve deeper tissues or organs and can present with fever and chills, fatigue or general malaise, severe pain in the affected area, coughing, shortness of breath, and chest pain if the lungs are involved, rapid heartbeat or low blood pressure if the infection leads to sepsis, and swollen joints or difficulty moving the affected area if the infection spreads to the bones or joints. Toxic shock syndrome, a rare but serious condition caused by toxins produced by Staphylococcus aureus, can also occur, with symptoms including sudden high fever, vomiting and diarrhea, muscle aches, a rash often resembling sunburn, confusion or disorientation, and organ failure in severe cases. Staph infections are caused by the bacterium Staphylococcus aureus, typically occurring when the bacteria enter the body through breaks in the skin, such as cuts, abrasions, surgical wounds, or insect bites. Common causes and risk factors include direct contact, where staph bacteria can spread through close skin-to-skin contact, especially in crowded conditions like sports, gyms, and healthcare settings, contaminated objects, such as sharing personal items or surfaces that have been contaminated with the bacteria, a weakened immune system, which puts individuals at higher risk, surgical wounds that become contaminated, intravenous drug use with non-sterile needles, and chronic conditions like diabetes, cancer, or heart disease. A healthcare provider will typically diagnose a staph infection based on symptoms, medical history, and physical examination. To confirm the diagnosis or identify the specific strain of bacteria, additional tests may be performed, including a culture and sensitivity test, where a sample of pus, blood, or tissue from the affected area is taken and cultured to identify the bacteria causing the infection and determine which antibiotics the bacteria are sensitive to. Blood tests to check for signs of systemic infection or to identify the spread of infection into the bloodstream, and imaging tests like X-rays, CT scans, or MRIs if the infection is suspected to have spread to internal organs. The treatment for a staph infection depends on the severity and location of the infection. Options typically include antibiotics, where oral antibiotics like dicloxacillin, cephalexin, or clindamycin are often prescribed for skin infections, and intravenous antibiotics may be needed for more severe or deep infections. MRSA infections are more difficult to treat due to resistance to many common antibiotics, requiring alternative treatments. Drainage of abscesses may be necessary if the infection has caused a collection of pus, often done in a sterile setting under local anesthesia. Supportive care may be required for severe infections, especially if they spread to the bloodstream or cause toxic shock syndrome, involving hospitalization, for fluids, pain management, and monitoring of vital signs. While not all staph infections can be prevented, several steps can help reduce the risk, including good hygiene practices like frequent hand washing, keeping wounds clean and covered, avoiding sharing personal items, proper care of cuts and surgical wounds, avoiding close contact in high-risk areas, regular cleaning of frequently touched surfaces, and antibiotic stewardship to reduce the risk of antibiotic-resistant strains. A staph infection is caused by Staphylococcus aureus bacteria and can lead to a range of symptoms, from minor skin problems to life-threatening conditions like sepsis or toxic shock syndrome. The infection is typically spread through direct contact with infected skin or contaminated objects. Treatment involves antibiotics and, in some cases, draining abscesses or surgical sites. Preventative measures include practicing good hygiene, proper wound care, and avoiding sharing personal items. For more serious infections, especially those involving MRSA, specialized medical care may be required.